Next in the series of Demystifying Healthcare, we're going to talk about EOBs and how to see the common discrepancies in an EOB. Don't forget, this is a series of videos, so if you want to find out a little bit more about what an EOB is and how it can help you and how it's related to your insurance, make sure to watch the first video in the series where I go over all of that. So when you receive the EOB and you also get a bill from the provider, okay, for the hospital or doctor, you're gonna wanna check for discrepancies. First of all, are you being charged for services that you didn't receive? Believe it or not, mistakes like that actually happen. So make sure you receive the services that you're being billed for. And also just check for discrepancies, errors on the codes. So with codes, how insurance goes to apply your insurance coverage, how the companies do this is by the codes that are put on the actual the claims that are filed by the provider. So you want to make sure, like, was it an injury, was it an accident, was it an illness? You just want to look at that and get yourself familiar with the codes. And usually on the bottom of the EOB, it'll tell you like almost little like footnotes that'll tell you, if something wasn't covered, why wasn't it covered? And then that's something you can go to your insurance agent about. Now, don't get me wrong, you don't have to become an expert at coding. I mean, my goal is to have you be empowered. So just when something feels off and it looks wrong, that's when you can come to me and I'd be happy to help you sort it out. And sometimes we have to call the provider, let me give you an example of why this is important. A lot of the plans that I specialize in for my clients, I have accident coverage on there. Like they have supplemental accident coverage that will kick in and pay them a benefit if there's an injury or accident or anything that is not an illness, basically. And so this happens really often. And so a lot of times the doctor or the hospital will not code it as an accident, they'll code it as an illness. So what happens is the insurance then does not know that they have to pay that person's accident coverage toward that claim. And so they'll end up with a bigger out of pocket than they should. So that's how it's really important in that area. And that's why if you need an agent who will take the time to actually do that for you, I'm your person. So if you're looking for an agent who is willing to go that extra mile, reach out to me. I'm licensed in most states. And if I cannot help you myself, I will put you in a much better position than you were when you first came to me. You can reach out to me at alexthehealthagent.com or follow me on Instagram, where there's lots of fun videos like this one to educate and empower you. And if you found this video helpful, please share it and comment, like, and subscribe.